Hi, my name is Nur binti Kamaran Zaman, and my matrix number is 298966. And my part is an executive summary. This report discusses healthcare ethics through two cases of medical negligence, one in Malaysia and one in India. So the first case involved Nurul Damir Ashikin Ayo from Johor, who suffered severe internal injuries after an IUCD was incorrectly inserted at a government clinic. So the second case involves Simran Chabra and two other patients in India who died after receiving the improper IV treatment for a minor cold at a private hospital. So this case raised concerns about poor communication and lack of accountability from the hospital management. So the purpose of this report is to compare the ethical issues in both cases and examine the professional responsibilities of healthcare providers. So it also evaluates how the action affected patient safety, public trust, and ethical standards in healthcare. So to understand these issues, the report applies the ethical theories of utilitarianism and deontology, which help explain the moral impact of the healthcare professionals' decisions. So both cases involve medical negligence and a failure in the duty of care, resulting in harm to patients and reduced public confidence in healthcare services. So however, the Malaysian case focuses on negligence during a medical procedure, while the Indian case involved inappropriate treatment and inconsistencies in medical information. So, in conclusion, the both cases highlight the importance of ethical conduct, professionalism, transparency, and accountability in healthcare. Thank you.
Assalamualaikum and hi, my name is Nurul binti Zulkifli and my matric number is 299014. Ethical issues in the medical sector are moral problems or challenges that arise when healthcare professionals must ensure patient safety, respect patients' rights, and provide quality care and act responsibly and honestly in their medical practices. According to the article, the local news involved medical negligence by a doctor during the insertion of an IUCD. A 24-year-old mother of two suffered serious complications when the device was misplaced inside her body. Although she already complained about the pain, her concern was dismissed as a normal reaction. Later, it was discovered that the procedure has punctured her uterine wall and appendix. As a result, she can no longer become pregnant and give birth naturally. She is now planning to take a legal action against the medical team, and while the Johor Health Department has formed an investigation committee to examine the case. For the international issues in India, a 24-year-old student died after not receiving a proper medical treatment despite suffering from a high fever for several days. His family only received the medical report months after his death. Other patients also experienced delay in receiving treatment. In addition, many medical records are still handwritten, making it vulnerable to loss and tampering. India also lacks an independent body dedicated to investigating medical negligence cases, making it difficult for victims and their family to seek justice. These cases highlight several ethical issues in the medical sector, including medical negligence, lack of accountability, poor communication, and delayed treatment. And healthcare professionals have an ethical duty to provide safe and competent care, listen to patient concern, and act in their best interest. When mistakes occur, medical teams should be transparent and take fully responsible for the action. Patients also have the right to receive timely treatment, accurate information, and a proper medical documentation. In conclusion, both cases demonstrate how medical negligence can have a devastating consequence for the patient and their families. Therefore, healthcare providers must uphold professionalism, accountability, transparency, and patient safety. Government should also strengthen healthcare system through reforms such as independent investigation bodies and digital medical report to improve patient protection and prevent similar incidents in the future.
My name is Angin Wei and matric number is 297768. The first ethical issue applied in the local case is professional competence. Healthcare professionals are expected to possess the necessary knowledge, skill, and judgment when carrying out medical procedure. However, in this case, the doctor incorrectly inserted the IUCD and failed to identify signs that something was wrong during the procedure. The second ethical issue is the safety and duty of care. The patient complained of experiencing severe pain during the insertion of process. However, the doctor dismissed her complaint as a normal symptom. As a result, the patient did not receive immediate treatment, which eventually led to several internal injuries. In the international case, the first is the violation of non-malfeasance, which means healthcare providers should avoid causing harm to patients. However, Simran was given a strong medication that was not suitable for a simple cold and coach. The second issue is veracity and medical integrity. There were inconsistency between the doctor's explanation and the findings of the post-mortem report, raising concern about honesty and transparency. The third issue is the duty of care, as questions were raised regarding whether proper emergency treatment was eventually provided. Finally, there is an issue of justice ethics and semantic accountability because the family faced difficulty in obtaining evidence and seeking legal accountability. There are three unethical practices were highlighted in this local case. Firstly, the doctor incorrectly inserted with IUCD, which causes serious injury, including a perforated uterus and damage to the intestines. This injury later required surgery and affected the patient's ability to deliver children naturally in the future. Secondly, the doctor demonstrated weak professional judgment by ignoring the patient's complaint of abnormal pain and treating it as a normal reaction. Thirdly, concerns were raised regarding the accuracy of the preliminary examination, which had reportedly shown that the patient's uterus was in a good condition before the procedure. First unethical practice for the international case, Simran received an inappropriate and unjustified treatment when a powerful intravenous medication was administered for a minor illness. Second, there were concerns that responsibility was avoided when she was transferred to another hospital after her condition became critical. Third, there were allegations that medical records may have been manipulated, especially because handwritten records can easily be altered or lost. Overall, this action reflects negligence and a lack of professional responsibility.
So based on the table of the comparison between the local case and international case, for the local case, the basic error is based on the unprofessional judgment by the doctors, okay, during and also the after the insertions. And then there's happens several internal injuries and inability to deliver the children naturally. And then, but for the international case, it's about the clinical miscalculations and also the pharmacy mistakes, and they are choosing to use the wrong or the unsuitable medications for a normal cold. And for the dimension in transparency and disclosure, for the local case, patient complaints, okay, get ignored by the staff and also is not proper informed about the patient's conditions, and happens some complications later raise concerns about the accuracy of the preliminary exams. But the international case, more is about the hospital control or evidence and also reliance on manual records and lacks of the independent CCTV oversight. In terms of the application of utilitarianism, based on the local case, there's happening some minor mistake, cause lifelong suffering, and also raise public concerns regarding to the medical sector's overall abilities. But the international case is more to this system mistake rather than ensuring the patient safety negatively impacting the majorities, and also highlight the needs and autonomous safety organizations. But the deontology applications, it's failed for the insection and also the poor judgment by the medical staff. And also for the international case, overall is about they are choosing the unsuitable and also the wrong method of the medication and lead to fatality.
Hi, my name is Shafiza binti Sabri and my number matric is 299194. Today I will be presenting the conclusion part of our presentation. I will briefly summarize the main ethical issues identified in this case and highlight the key lessons and recommendations for improving the healthcare system. From a utilitarian perspective, this case demonstrates how failures in the healthcare system can negatively affect both patients and society. The negligence involved cause physical and emotional harm to the patient and reduce public confidence in healthcare institutions. These incidents reveal weaknesses in the system, including a lack of transparency, weak accountability, and insufficient safeguards against medical errors. When patient safety is not prioritized, the overall well-being of society is affected. Therefore, reforms such as independent investigations, better electronic medical record systems, and strong evidence management are necessary to prevent similar incidents and protect the public incidents. From a deontological perspective, healthcare professionals have a moral and professional duty to provide competent care, ensure patient safety, and act honestly. In this case, the doctor alleged failure to correctly insert the IUCD and respond appropriately to the patient complaints raises concerns about professional competence and duty of care. In addition, the inconsistencies between medical statements and autopsy findings raise questions about honesty and transparency. The hospital handling of evidence also creates concerns about fairness and accountability. In the conclusion, this case highlights not only possible individual negligence but also broader weaknesses within the healthcare system. To prevent similar incidents in the future, it is important to strengthen ethical standards, improve transparency, enhance monitoring and accountability mechanism, and ensure fair legal procedure. These improvements are essential to protect patients, uphold justice, and restore public trust in the healthcare system. So that's all from me. Thank you.
Okay, next ethical lesson. Based on the two cases that we have discussed, there are several important ethical lessons that can be learned by healthcare professionals and healthcare institutions. First, professional competence is essential in medical practice. Doctors and healthcare workers must have the necessary knowledge, skills, and professional judgment before carrying out any treatment or procedure. In Nurodamia case, the incorrect insertion of the IUCD caused several internal injuries that affect her future ability to give birth naturally. In Simran case, the administration of an inappropriate injection for a minor illness result in her death. These cases show that poor medical judgment can have serious and life-changing consequences for patients. Second, patient safety must always be the top priority. Healthcare professionals have a duty of care to protect patients from harm. Patients' complaints and symptoms should never be ignored or dismissed without proper assessment. In Nurodamia case, her extreme pain was considered a normal symptom, which delayed further medical intervention and worsened her condition. Therefore, healthcare providers must always listen carefully to patients and respond appropriately to any warning signs. Third, accountability and justice must be accessible to every patient. Both cases demonstrate the difficulties faced by patients and families when seeking justice after medical negligence occurs. In India, legal action is often difficult because another medical expert is required to confirm negligence. In Malaysia, the investigation is still ongoing and the patient has yet to receive an apology. This situation highlights the importance of transparency, accountability, and fair investigation process in healthcare. Medical professionals and healthcare institutions must be willing to take responsibility for their action and ensure that patients receive fair treatment. In conclusion, these cases remind us that healthcare ethics is not only about treating illnesses but also about protecting patient safety, maintaining professional standards, and ensuring accountability. By strengthening professional training, transparency, and ethical practices, healthcare system can be better, protect patient rights, and prevent similar incidents from happening in future.